Hi guys, Dr. Rahul this side. So today we will discuss about different hypersensitivity reactions. Okay, so in this slide I will take examples, right? So we will start. 1 second. Yes. So we will first talk about your type 1 hypersensitivity reaction. Okay. So I will take a different slide. Okay. So here I am writing hypersensitivity reactions. Okay. So this is your type 1. Okay. So talking about type 1 hypersensitivity reaction, it is also known as immediate, okay, immediate or reagenic hypersensitivity reaction, immediate or reagenic, okay. So actually let's talk about the mechanism, okay. So actually it is mediated by antibody IgE, okay. Remember, it's an important antibody that maintains your type 1 hypersensitivity reaction, okay. So actually these are your cytotrophic cells, okay, cytotrophic cells, right? IgE, 1 second, yes, IgE, B cell, then your mast cells, right? Then basophils, okay, eosinophils. These are the important cells that maintains your type 1 hypersensitivity reaction, okay. Now if they ask, right, some vasoactive amines or histamines, if they play any role or not. So also remember some important roles of other agents like T helper 2 cell, then your important vasoactive amine, which is your histamine, okay. These are also important, they also plays an important role, okay. Histamine actually slows the reacting substance of your anaphylaxis, okay. Then your leukotrienes, yes, leukotrienes, particularly LT, B4, then C4, D4, okay. So these all cells play an important role in your type 1 hypersensitivity reaction. Let's talk further about the effects of type 1 hypersensitivity reaction. Here I will also mention your examples, right? So if we talk about systemic acute anaphylaxis and about local, okay, local is mainly your atopy, okay. So if we talk about systemic anaphylaxis, so your example will be like bee sting or some insect bites, or you can say anaphylactic shock, okay. So this becomes your examples of systemic anaphylaxis, okay. And if you talk about local anaphylaxis, there are many, a list of it, right? Like urticaria, then angioedema, then you have got hay fever, or okay, hay fever, all right. Then you have got asthma, right? Eczema, Cazonis test, where is it done? Yes, correct, hydrated cyst, okay. Then you have got Dale phenomena, okay, Dale phenomena. So all these are examples of local anaphylaxis, all right. So we will revise later on. For now, let's move on to type 2 hypersensitivity reaction, okay. Type 2 hypersensitivity reaction. Now remember, it is also known as, I will write for you, cytotoxic, okay, cytotoxic or cytolytic hypersensitivity, all right. Okay, so here the antibodies involved are your IgG, okay, or IgM, okay, very important, IgG or IgM. And what is the mechanism involved? It is the lysis or phagocytosis by opsonization, okay. Most commonly it will involve the blood cells only, right? So just remember, phagocytosis or opsonization. Opsonization means directly killing the infectious agent, okay. All right. Now effects. Okay, if we talk about effects, here I will also mention the examples as well, as you know. So actually, if I talk about complement dependent effects, okay, complement dependent, just remember transfusion reactions. Okay, it is your type 2. The examples are very important. Okay, transfusion reaction and erythroblastosis fetalis. Erythroblastosis fetalis. Okay, 1 second. Okay, so we are discussing about this one, type 2 hypersensitivity reaction. Okay, yes, so the complement dependent effects, right? And the examples were transfusion reaction, erythroblastosis fetalis. There are some other examples as well, which are not complement dependent. Okay, like hemolytic anemia. These all are examples of type 2 hypersensitivity reaction. Okay, hemolytic anemia. All right, then you can say drug induced hemolytic anemia, right? Then pemphigus syndrome, right? Pemphigus syndrome. Then you can say bullous pemphigoid. Okay, pernicious anemia. Okay, let me write it, pernicious anemia. Then thrombocytosis or thrombotic phenomenon. Okay. Then acute rheumatic fever. So they all come under type 2 hypersensitivity failure. Okay, this is acute rheumatic fever. Okay, then so this is all. Okay, now we will talk about your important type 3 hypersensitivity reaction. Okay, type 3 hypersensitivity. Now here the antibodies involved are your IgG or IgM. Before that, I will also like to mention this is also known as immune complex mediated hypersensitivity reaction. IC is immune complex. Okay, antibodies involved are IgG, IgM. Clear? Now they actually, I will have to write the mechanism. Okay, mechanism here is important. You have to understand that these antibodies, which is IgG or IgM, they will go and activate your complement system. Okay, complement system. Now regarding the complement system, we will see in microbiology section. Okay, now they will go and attack your neutrophils. Okay, they go and attack your neutrophils and will release lysosomal enzymes. So there will be release of lysosomal enzymes, right? So that is how it is immune complex mediated, right? Now the effects, again, it can be local or can be systemic, and we will see the examples. Okay, so local is actually Arthur's reaction. Local we say as Arthur's reaction. All right. Local we say this as Arthur's reaction, and examples is your panarteritis nodosa, farmer's lung, hypersensitivity pneumonitis, Arthur's reaction. So these are all your examples of type 3 hypersensitivity reaction. Okay, panarteritis nodosa, farmer's lung, HSP. Your HSP is your hypersensitivity pneumonitis. Okay, and Arthur's reaction, right? Talking about your systemic immune complex, as known as serum sickness. Okay, serum sickness, and the examples include your SLE, very important, glomerulonephritis, rheumatoid arthritis, graft rejection. Okay, then infective endocarditis, Henoch-Schönlein purpura. This HSP is your Henoch-Schönlein purpura. Then Schick test, type 2 lepra reaction. These are examples of your type 3 hypersensitivity. Okay, talking last about your type 4 hypersensitivity reaction, there is this is mediated by T lymphocytes, or you can say CD4 cells. Okay, CD4 cells or T lymphocytes, and it is actually cell mediated, and the examples here is your simple tuberculin test, lepromin test, type 1 diabetes mellitus, then your schistosomiasis test, contact dermatitis, very important, type 1 lepra reaction. Alright, these are all your examples of type 4 hypersensitivity reaction, right? So I will revise here for you. That is for type 1 hypersensitivity reaction, the antibodies involved are your antibody IgE. Examples are you saw. For systemic, it is bee stings, insect bites, anaphylactic shock. For local, it is urticaria, angioedema, hay fever, Cajonis test. Okay, PK reaction. For type 2, also known as cytotoxic hypersensitivity, antibodies are IgG, IgM, where there is phagocytosis, opsonization of the opsonization is the mechanism. Okay, and examples are your transfusion reaction, erythroblastosis fetalis, hemolytic anemia, pemphigus, pernicious anemia, acute rheumatic fever. If you talk about type 3, it is immune complex mediated, antibodies are IgG or IgM, and actually complement activated system. Okay, and examples are PAN, then farmer's lung Arthur's reaction, SLE, glomerulonephritis, Henoch-Schönlein, purpura type 2 lepra reaction. Talking about type 4, it is made by CD4 cells or T lymphocytes, and examples are tuberculin test, lepromin test, type 1 diabetes mellitus, type 1 lepra reaction. Okay, so this is in short about all your hypersensitivity reactions. All right.